Hi, Dr. Larsen here. I have an excellent video for you today. Has to do with, do you have the proper stomach acid? Now, the vast majority of people in my office that I see, that I consult with, and the patients that come in, they have all kinds of GI symptoms and other things which we'll talk about coming up, but the vast majority of them actually have low stomach acid. Even though they've been taking antacids and all kinds of acid-stopping drugs, they actually have low stomach acid, which we'll talk about coming up here. So how can you tell though if you have low stomach acid? And here's what many people report. Now they report bloating, belching, burning after meals. Yes, even burning after meals is a sign of having low stomach acid because your food is literally rotting inside of your stomach, creating organic acids. I have a whole video on that as well. Just search through my website or my YouTube channel. But all of these are symptoms of actually low stomach acid. Feeling of food just sitting in the stomach, not being digested. I hear this quite a bit as well. It just kind of sits there. Well, it's sitting there because you don't have enough acid to break it down. So you're supposed to digest your food. And every section of your GI tract has a certain job. And the job of the stomach is to mix and churn things, but its main job is to start to break down the proteins and the structures in there, and it does that with acid, hydrochloric acid, or HCl for short. Now going hand in hand with that, there is an inability to eat more than a small amount of food without feeling full. Because if it's not being broken down, you don't want to keep stuffing more food in there. Okay? That's why this scenario occurs. Now many are constipated, so a lot of people are constipated having low stomach acid, but others have diarrhea. And still others have totally normal bowel function. They have no clue that they even have digestive issues or low stomach acid. So it doesn't have to be all the same. It's not this narrow focus of if you have these three things, then you have low stomach acid. It can be different for every single person. Now how about physical signs of low stomach acid? Again, bloating after a meal, burping, those are physical type signs. Weak, easily broken, and peeling fingernails. Now in my office I look at fingernails, I look at the tongue, I look at the eyes, I look at the creases on the ears. These are all clues as to what's happening on the inside of the body, especially the fingernails. So if you have weak, they break easy, or they're peeling fingernails or ridges in them, there's different markers for this. You're not breaking your food down. You're not breaking your protein down, and it's not being absorbed and then utilized in things like your fingernails. So your fingernails are a really good marker of what's happening on the inside. We also have hair loss, more so in women, not like a male pattern baldness, but in women if they're having hair loss, that can be associated with thyroid disorders, but also with the GI system not working correctly. Gassy in the upper abdomen. So with this, again, if you're not breaking your food down, your food is rotting. And when it's rotting, it's fermenting. And that's what people mistake with having too much stomach acid. They feel that heartburn. They feel that gassiness coming up. And what's occurring is your body is creating, your stomach's creating acids. And these acids are coming up. Actually, back that up. Your stomach's not creating them. The food is creating the acid. It's rotting and fermenting inside of there. And that's where the gas is coming from. Here's another one. In non-alcoholics, okay, the unusual dilation of capillaries of the cheeks and the nose. So this is a sign of an alcoholic. So that nose that kind of gets big, especially in like older men who have been drinking hard alcohol, they get kind of like an enlarged nose. Capillaries, so those red streaks, kind of red blotches and marks here, in the cheeks and the nose has to do with alcoholism, but in someone who is non-alcoholic, it can be a sign of low stomach acid as well. Now how about any disease processes that are related with low stomach acid? We have hypochlorhydria, so that's what this is technically called. Hypo meaning low, chlorhydria meaning inadequate hydrochloric acid production. Okay, that's the technical term. It's linked to not only GI symptoms, but also autoimmune diseases. Because again, autoimmune is a combination of things happening. It's toxins, it's poisons, it's nervous system stress, it's mental emotional stress, and it's GI dysfunction at its core. And then other degenerative diseases of all kinds. So heartburn, of course. A lot of people think, well, heartburn, that's got to be too much stomach acid. Again, no. Remember what I said. It's too little stomach acid, the food's rotting, creating organic acids that are coming up and they're burning. I have a whole video on this as well, so find that one. Yeast infections, toenail fungus, and athlete's foot, all part of the same problem. You can't break down the food, you can't disinfect it, the bowel starts having changes, the body starts having changes. These two things here are not from the outside. Again, vaginal yeast infections as well. It could be intestinal, vaginal, wherever. Those types of things are not coming from the outside. So a topical is not what you need. You need to kill that from the inside of your body and figure out the source and why it was easily acquired by yourself or whoever has it. So athlete's foot. And then we have gallbladder disease as well. So if you think about it, your stomach empties into the small intestine. Well, right at the top of the small intestine, your gallbladder and your pancreas hook up there. So if you don't have the right environment, if you don't have the right acids moving through that upper small intestine, your gallbladder, your pancreas, your liver, none of them get signaled correctly. So you get gallbladder diseases set up. You get things like diabetes, because diabetes is a pancreatic issue. The pancreas is being stressed. All right? And then under or overactive thyroid as well. Again, we can't look at things as one thing like the thyroid or one thing like the stomach or the liver or the gallbladder. Everything has to work in synergy in the human body. Kids, childhood asthma, eczema. These are signs of low hydrochloric acid, which is actually common in them as well because they're not getting enough salt. And I have a video on salt as well. I'll talk about salt coming up, but in children especially, they need salt because salt is what actually helps your body make hydrochloric acid. It provides the chloride part of it. NaCl is salt, sodium chloride, and then we have HCl, hydrogen and chloride together. So that chloride part is what helps your body to make the hydrochloric acid. Osteoporosis, if you can't digest your food, you're not absorbing minerals. You need a very acid state to absorb calcium into your stomach and into your body. So things like the over-the-counter things that are having calcium in them, I won't name names, but it's an alkaline environment. You're not absorbing the calcium from that. Constipation and irritable bowel syndrome, of course, you're going to have changes with the GI symptom as well. And now we start to see some of the autoimmune conditions. And I could list 200, 300, 400, however many there are now on here. Rheumatoid arthritis, lupus, scleroderma, Hashimoto's, you name it. Autoimmune conditions as one of the pieces of why you have it or why someone has it has to do with the GI system. Chronic hives, skin stuff is always GI, weak adrenals as well, and then chronic hepatitis, so inflammation of the liver. Again, you have to have the correct flow of the right kind of acid solution moving through that small intestine. Vitiligo, so pigment changes, again, hydrochloric acid is very important for that. Carpal tunnel syndrome. I've seen too many people get carpal tunnel releases on both hands. If you have carpal tunnel symptoms in both hands, it's not coming from the wrist. I can guarantee you that. I'll probably do a video on that as well because it's really irritating to see this. Carpal tunnel releases and then 3, 4, 6 months later they have the pain again because the fluid buildup in here was coming from somewhere else. The answer isn't to release this. Now there's of course certain situations where this surgery is the correct thing, but not when you got it both hands. Unless you jammed your wrist both sides, which no one ever does really, it's very rare, it isn't coming from there. One aspect is digestion. I find it over and over and over again. You clean up the GI tract, you increase the stomach acid production, the overall body inflammation goes down, and the carpal tunnel frees up and the nerve can function how it's supposed to. Bursitis, which is inflammation of the bursa sacs. The bursa sacs are inside of all the joints and they provide that nice sliding surface. So if I'm gonna move my arm like this, there's actually a bursa sac in there. Those can get inflamed. lack of stomach acid is actually one of the symptoms of that, or bursitis is one of the symptoms of lack of stomach acid. And then things like rosacea, so again, skin conditions. So what about a stomach acid assessment? So how do you know if you have this or not? Now, a couple steps here. Number one, first thing in the morning, okay? Don't drink anything, don't eat anything. Just do step two. Mix a 1/4 teaspoon of baking soda in about 8 ounces or so of cold water, okay? Step three, drink the solution, okay? So step one, first thing in the morning. Step two, mix up this combination. And step three is to drink the solution. Now, step four is time how long it takes for you to belch or to burp. Up to 5 minutes. Don't worry about past 5 minutes, because if you've gone past 5 minutes, you definitely don't have much stomach acid or hydrochloric acid in your stomach. And here's why. With adequate levels of hydrochloric acid, which your stomach makes, you should belch within about 2 to 3 minutes. Okay, if you start belching like crazy before that, you've got way too much acid. But about 2, 3, 4 minutes, somewhere around that range, if you have adequate levels. The vast majority of people don't, so they won't be belching. And here's the reason why. The belching results from the acid and the baking soda combining. So it's a chemical reaction. So you have acid in your stomach makes it. You're putting an alkaline solution, so baking soda down there. Those two combined create a chemical reaction, reacting to form carbon dioxide gas. So with the gas, it makes you want to belch. All right? Now, remedies for this. Now, there's multiple different reasons why people have low stomach acid. One of them is stress. When you're under stress all the time, your body shifts away from digestion. So that's an issue as well. But we have some great remedies for this. Now, here's the most important one that I like, pink salt. This is where we start with everybody. Now, if you're a kid, you really, really need pink salt. This is one of my favorite things on the planet because it is so deficient in so many people. We're eating this melted, heated junk salt that's in the stores. This is what you need. Now, why is that? It's because sodium chloride is what salt is. Now, pink salt has other minerals and other trace elements as well. But the chloride part, remember, hydrochloric acid, chloride and chloride. So you need chloride to make hydrochloric acid. So especially in young kids, half teaspoon a day, sometimes even a teaspoon and a half if they're sweating a lot. So pink salt's really important. I get all the kids on it, and I usually put the adults on it as well. And people absolutely love this salt. Number two is a product called hcl-xym. This is my new favorite. So again, I'm not interested in just giving a bunch of just quick fix remedies, but a lot of people want this. And now this is what I use. So as you get older, 35, 40, 50, 60, 70 years old and beyond, your body is making less and less hydrochloric acid every single year. And because of stress and the food and all kinds of different factors. This is my favorite right now. Again, it's on shoplarsenwellness.com. I put it on there for this reason. I have my patients buy this. It's combined with some enzymes, which actually enhance it and make it better. Now, I also like this one. It's called Premier HCl. I used to use this one exclusively until hcl-xym came around. But realistically, you can't go wrong with either one of them. And it's a simple test. It's a simple test to figure out, hey, when I take some towards the end of a meal or after a meal, take 1, take 2, take 3. In bigger meals, things that I really want to break down and digest, I'll take 3 or 4. If you're 280 pounds, you might need 5 or 6 of them to fully break down that really heavy meal. It's different for every person, so I'm not prescribing anything for anybody. But HCl, and again, my new favorite is this hcl-xym. And they're inexpensive too. So pink salt, hcl-xym, and Premier HCl, they're all inexpensive. And it's one of the first steps that I do with a lot of my patients is get them on these products. And again, you can get that from shoplarsenwellness.com if you want those. The other one that I had just thought of was a product called Vintage Vinegar. Vinegar is an acid solution. We have it on the website as well. Fantastic. It's the real vinegar, not most of the things that are in the store. It's actual real vinegar, and you can use this as well, just like you would use HCl. Again, HCl is used towards the end of a meal. Let your body use its own stores, but because of our food, because of our stress, it gets exhausted, and then you give it a shot of more and break down that food fully. I think you'll really enjoy the benefits of that. Again, I'm Dr. Brant Larsen. Hope you liked the video, and I'll see you again soon.